We've been reading a lot of tweets and Facebook pages and what have you on rhetoric about, cut the fraud, cut the waste, and use that money to fund LDH and make the cuts necessary. What's the time frame if you find anyone or any provider that is committing fraud? What's the timeline on anything being given back to? You may not even get it. The Attorney General may get out most of the money anyway because of his fraud unit. But even though you find fraud, don't you have to return money back into the Medicaid program or to CMS if there's a problem?
So, and I'll just say we are taking the recommendations of the Fraud Task Force seriously. As you saw, we've already implemented the 10%. We're looking at using tax returns. We take it seriously. But again, I think this issue has been overemphasized because nationally we perform very well. Historically, we do very well on collections. Now, you don't make your money on getting collections back from fraud, just like Target or Walmart doesn't plan on making money by getting all the groceries that might leave and just somehow getting them back. It just doesn't happen. The way you do it is preventing it in the first place. And let me say this, it's also, I think there is a war on poor folks in this country right now. People making less than 400% of poverty are the 40% of our population. They need Medicaid because they are low income and their employers don't offer them insurance and they want to go get health care. And I think that's okay, right? And so when we talk about fraud, we're talking about people, the waste is the problem. It's things that are healthcare services that shouldn't be done. Maybe doctors prescribing things that people don't need. But it's the providers, by and large, the clients getting services. Our clients getting services. I think sometimes that gets lost. I think there are misconceptions that people are running around taking money. That's not the case. What we're talking about is healthcare services. And we want to be sure that in that month that people are getting them, that they really did qualify for Medicaid. But again, I think we need to focus on the fact that people are low income in this state. Until we fix that problem, people are going to need Medicaid.
And that's